Good morning, Minister Anthony, and thank you for joining us this morning for today's COVID-19 update.
Now, because of the sheer contagiousness of the disease, we have seen that numbers would climb rapidly. And in our hospitals here in Guyana, we have seen a steady increase in patients. So while it might be milder and a lot of people would get infected and they stay home, we are seeing some people who are coming into the hospital. Now, our experience locally has been that the persons who end up in hospitals, most of them are a little bit older, most of them are unvaccinated, and most of them, they have underlying diseases.
Minister, for persons who are unvaccinated, how high do you think is the risk of infection and even death?
Well, it's very high. We know that vaccination would help to prime the immune system. So you have what is called innate and adaptive immunity, and vaccination would help to do that. So that if you come in contact with the virus, then your immune system would have already been prepped. If you don't get vaccinated, then it would be your immune system would take longer for you to react, and by which time more damage can be done to other organs of the body. One of the hallmarks of Omicron infections is that even if you had one of the previous variants, whether it's alpha, beta, gamma, or delta, that Omicron can reinfect you. And that's because of the different mutations that it has. That's why we have seen reinfections.
Minister, who would you say is more vulnerable to the disease?
Well, a couple of categories of people we can earmark based on our experiences here and based on the hospitalization that we are seeing. I would say that older people remains vulnerable. People who have underlying illnesses such as diabetes or respiratory illnesses, hypertension, kidney diseases, and so forth. So a lot of the chronic non-communicable diseases, if people have them, they are at higher risk of getting a more severe form of COVID-19. Of course, people who are unvaccinated as well, if you have not gotten any one of the doses, then you're also at risk for COVID-19. There are some other categories of people, unfortunately, smaller groups of people. So, for example, persons with HIV, again, because they have a serious underlying illness, and for those of them who really have not been on their medication for HIV, they can be at higher risk. So those categories of people should also make sure that they get vaccinated. So in terms of our vaccination numbers, for adults, we have right now 424,702 persons receiving a first dose vaccine. That's 82.8% of our adult population. And then for second dose, we have 314,960 persons receiving a second dose vaccine, or that's about 61.4% of our adult population. In terms of 12 to 17, we have 32,703 persons getting a first dose. That's 44.8% of that age cohort. And we have 23,156 receiving a second dose. That's 31.7% of that age cohort. Booster doses has gone up a little bit, so we are now at 40,220 doses.
All right, Minister, thank you for joining us today.
Thank you very much.